consanguineous marriage or getting married to a person who is related by blood to you, does this lead to any birth defects or chromosomal abnormality in the child you're going to have? I'm Dr. Archana S Ayyanathan from Dr. Archana IVF, Ananagar East, Chennai. So, consanguineous marriage means getting married to a person who's related by blood to you. That is, we say there is degree 1, 2, 3 in consanguineous marriage. That is, if you get married to your uncle's son or uncle's daughter, then it becomes a degree of consanguinity. Then if the relative is going to be like a second cousin or a third cousin, it depends upon the degree of consanguinity. So the degree of consanguinity is actually 3 types, 1, 2 and 3. Whatever it is, if you are getting married to a blood relative of yours, there is definitely a chance of increased birth defects in the baby or the baby having a chromosomal abnormality also. But it does not directly give rise to a baby with birth defects or chromosomal abnormalities. It is an indirect effect, meaning if you have any familial, genetic or hereditary disorders running in your family, say for example if there is a genetic disease running in your family and your husband is a carrier of it and you are also a carrier of it, so your children have a chance of 25 to 50% of having the disease. So in such cases, if the disease is going to be fatal or if the disease is going to be which is not correctable, no, then it becomes very difficult for the baby to survive also in some situations. So is there a way to detect such abnormalities before conceiving, and is there a way to avoid such things? So if you are in a situation to get married to your blood relative, what you should do? You should definitely go attend a genetic counseling. So for the genetic counseling, the husband and wife, both pending parents, go and meet the genetic counselor. They get an opinion whether they have any genetic or hereditary disorders running in their blood, and then if there is anything running in the blood, then we have to definitely do an advanced treatment for you, that is advanced fertility treatments where we call as ICSI IVF, right? So in those treatments, what we actually do is we make an embryo, and before freezing the embryo, we take the cell out of the embryo. We do a biopsy of these cells, and then we assess the cell to find out if there are any abnormalities in the child or not. So this test is actually called pre-genetic testing. So this is of 3 types: pre-genetic testing for aneuploidy, pre-genetic testing for structural rearrangements, and pre-genetic testing for mutations. So these are the different types of the way these hereditary disorders come into our cells. So these kind of check and biopsies give us an idea whether that embryo is going to have the particular disease or not, and whether the embryo is chromosomally normal or abnormal. So when we say PGTA, we are trying to find out if the chromosome arrangement of the baby which is formed is actually 46 chromosomes or if there is any change in the chromosome rearrangement. So this will give us a general idea whether the embryo is healthy, unhealthy in the point of view of hereditary genetic disorders and aneuploidies. So we get a report saying that the number of embryos whatever we have sent, which is normal, which is abnormal. So the normal embryos we transfer to you, the abnormal embryos we discard. So by transferring these normal embryos, you have a 100% foolproof chance of avoiding the hereditary disorder which has been running in your family, and you can completely avoid it transferring to your blood lineage. So as I told you previously, if you're getting married to your blood relative, this is a definitely important test, and this counseling is also definitely very important for you because this can avoid lot of problems, because once after the baby is conceived, there is no way that you can cure it of it, isn't it? Because this is disease which is running in the family. You can just detect if the baby is having or not. There are of course a lot of prenatal testing that is which is involved in the antenatal mother. We call it amniocentesis, we call it NT screening, we call it Down syndrome screening, we call it chorionic villus sampling. There are so many techniques and treatments available to find out if the baby which you are carrying is having any abnormality, if it is chromosomally abnormal or not. All those things can be done, but after conception, doing it is not going to change anything for your pregnancy. So we have to tackle it before conception. We are very clear and we are 100% sure that the baby is not having any abnormalities. So by doing a pre-genetic pre-conception evaluation, we are 100% sure that the baby is not going to have any of these hereditary diseases or any chromosomal abnormalities. So as we say, prevention is better than cure. Here we cannot cure the baby of the problem. So prevention is always the best cure for this kind of situations.